The cost of healthcare to you is about to get a lot more expensive in California under a new crazy law imposed by California Democrats just this past month. Coming up, I'll tell you what the law requires, how much it's going to cost you, and what we're doing to fight back. I'm Carl DeMaio, chairman of Reform California, and we've got bad news. Your healthcare costs are about to get a lot more expensive in California, and it's all because of a misguided, crazy new law being put into place by California Democrats. It was just signed into effect by Governor Gavin Newsom. And it's been driven by the labor unions in the state of California, who are always out there making more and more demands, irrespective of whether or not we can afford it. So let me walk you through what's going on and what we're doing to try to fight back. Here's the story from just almost a month ago, less than a month ago. New California law raises minimum wage to $25 for healthcare workers. And of course, you have the SEIU union. I call them the purple people eaters, out there with their signs. They were striking around the state of California. Now, this law offers $25 an hour minimum wage to healthcare employees. But before you think healthcare employees are doctors and nurses, no, that is what the lying liberal media and the politicians and the union goons always put forward as the window dressing on these policies. The $25 minimum wage applies to hospitals and healthcare providers throughout the state of California. And it would basically impact people who do the cafeteria work in the hospital, the clerical staff who do paperwork, custodians. It's all office support staff. So when you sit there and you think, oh, goodness, healthcare workers are going to get an increase. No. Nurses, aides, LVNs, doctors, pharma techs, all of them are paid well above any sort of minimum wage threshold that this law establishes. No, it really is for the supply chain and support staff of each of these healthcare providers. And it affects everybody, doctors' offices, hospitals. And what's interesting here is the union knows that it can't actually win a battle, even a strike against the healthcare providers because the market just doesn't bear it out. I always believe that minimum wage should be set by the market, supply demand, what you're worth, rather than giving everyone a wage that the government imposes. Instead, allow people to get what they are actually worth. A lot of these wage laws mean that people are all put in the same wage category, increasing costs for people who it's not justified for, which means there's less jobs, less to go around for people who actually should be compensated more. But all of this actually adds up to costs being passed on to you, the consumer. And in California, this is going to be a massive cost spike for all your healthcare expenses. When Newsom signed this law into effect, he said nothing about the cost. In fact, his administration said, we don't even know if it's going to cost any money. Well, now we have the cost impact. And it's just on the government side so far. And I'll tell you what it's going to be for private health expenses in just a moment. This is the headline from today's LA Times. Healthcare minimum wage expected to cost $4 billion in the first year as California budget deficit looms. Isn't this something that we should have heard about before the law was put into effect and signed? Where are all the liberal media outlets clutching their pearls, screaming and yelling, saying, how could politicians sign into effect a law with these many cost implications without knowing it in advance? No umbrage, no accountability, no transparency. It's just like, oh, yep, the law got signed into effect. Everyone got a $25 an hour minimum wage. So they're all celebrating, and the estimate is about 400,000 people would be affected by this law in the healthcare sector. But no one was asking, well, how much will this actually cost, and who's going to actually pay? Well, even though the governor's analysis showed fiscal impact unknown, and that was back in October 17th when he signed it into effect. 3 weeks later, after SB 525 was signed into law, we now know the price tag just for the government side of the ledger is $4 billion. And I have to say, shame on the media for not actually asking, well, how much is this going to cost the healthcare market as a whole? I actually have the answer to that. So just hold on a second there. And that's what you're going to see a lot more in terms of the cost to you. But to taxpayers, and yes, you do pay taxes. These are your tax dollars that are being impacted here. $4 billion in the coming fiscal year alone. And half of that's going to be coming from Medi-Cal, the other half from the federal government. I'm sorry, half of that is from the state's general fund. The other half is from Medi-Cal, which is reimbursed by the federal government. But it's a $4 billion hit immediately to the state of California. But you know that the state of California, even though it runs a lot of healthcare programs, is actually not the biggest chunk of healthcare expenses. And this is where I say shame on the media. They should have told you the cost to you, and it's not hard to find out. So if it's $4 billion to the state of California, what do we think the cost will be to everyone else who pays healthcare expenses in the state? Well, here's the California Healthcare Foundation 2023 Healthcare Spending Report. And take a look at this chart. And this is for 2020, by the way. This is for 2020. So the numbers are going to be higher in 2023. But healthcare was $405 billion, or $10,299 per person in 2020. It's probably more like $11,000 per person, and probably like $440 billion by now. But before we get into that, the share of the pie, the percentages paid by government versus by you, the private consumer, breaks down about the same. So if $405 billion is total healthcare spending, and that means what you pay on, for insurance, what the insurance then pays out to providers, what you pay out of pocket for your healthcare, all of that rolled together, $405 billion, of which $125 billion is from the private health insurance providers, and then you got Medi-Cal and Medicare for about $174 billion. So think about that. $174 billion of the expense is government. And then when you take a look at Medi-Cal of $87 billion and you divide that into the 405, that's about 21% is what the state of California is going to end up getting hit by. There's some additional expenses here. But all in, if $4 billion is being consumed by Medi-Cal and some additional state healthcare programs, let's round it up to maybe it's $120 billion annually. If that's $4 billion, then where are all the other $25 an hour costs going to go? Well, some of it's going to go to the federal government. They're going to have to absorb those costs. And it's probably with the federal employee healthcare benefits plan and Medicare, probably around the same amount, $4 billion for the feds, $4 billion for the state. And then what about private healthcare insurance? Well, the private healthcare insured coverage of $125 billion clearly is going to be at least $4 to $5 billion. And then where do we see the rest of the money here? Because 405 minus 125 minus 87 still leaves a residue of healthcare costs that are not borne by the government or private insurance of about $106 billion. When you add it up real quick, $4 billion to the state of California equates to about $12 billion easily to the rest of the market, insurers, as well as individual payers for healthcare services. This is going to have a ripple effect. It is going to increase the cost of not only your insurance premiums, but also the cost of your co-pays and any sort of expenses that you're paying out of pocket. If you're Someone who has a high deductible, a lot of plans have $3,000 deductibles per person, $6,000 in network, out network. You're going to see those costs add up real quick for your services. Let me give you another example here about how this ripple effect goes through the market. In California, healthcare costs are higher. And I'm giving you a little bit of an advanced peek at some work that the Transparency Foundation is doing on the cost of California in various categories versus the rest of the country. Well, in healthcare, California costs are higher. With massive subsidies, the California price of insurance is actually only 3% lower. So even with all the subsidies from the state of California on CalCare, Covered California, you're seeing a lot of costs that are being absorbed by you, the taxpayer, through higher taxes. When people say, "Oh, well, my premium that I have to pay is 3% lower than someone in a different state on average," recognize that they're already taking money out of your other pocket through taxes. So the insurance may be slightly lower, a smidge lower, but when you actually use your insurance, and remember, most of these plans have a high deductible or a copay. If you have to do an ER visit, California's cost is $2,960 for an average ER visit. That is 42% higher than the national average, which is $1,707.52. It is 79% higher than an ER visit in Maryland, which is the lowest cost state. We have to figure out what Maryland is doing to figure out how to reduce our costs. But you wonder, well, why is it $2,690 for an ER visit in California? Is the quality of care, 42% higher in our ERs than the national average? No, not at all. Is it 79% higher than the quality of care in Maryland? No. It's the operating environment. It's the costs that the provider, the hospital or the urgent care center, has to absorb because of various government mandates and regulations. And those are state government mandates. Everyone operates under the federal system, but really these are state government mandates that add to the cost of an ER visit. How about an ambulance service? So in California, the average cost of ambulance services are $2,407. In North Carolina, an ambulance ride is $661.50. We don't have a national average for ambulance services. We have limited data sets, but take a look at that differential, 73% higher. The cost of your actual health care services will be going up because now all these providers, if they're impacted by the minimum wage bill, and it's already $4 billion for the state of California, $2 billion in the general fund, $2 billion in reimbursable funds, you're talking, another $8 billion that's going to have to be absorbed by the private sector outside of the government state budget. Who's going to pay for that? Not the insurance companies, not some magical fund like the hospitals and the healthcare providers. They're going to pass that on to you in the form of higher prices. So right now we're looking at probably about $11,000 per person per year in healthcare costs in California. Staggering. Because remember, the figures back in 2020 were about 10,250. And if that was 2020, see this? Healthcare spending, $405 billion in 2020, or $10,299 per person. It's clearly going to be somewhere in the neighborhood with inflation of about $11,000 3 years later. And then on top of that, you add in a $12 billion immediate impact to the healthcare marketplace, and you're looking at least a levy of $250 per person per year in higher costs for healthcare. And you might say, well, $250, I can absorb that. Really? Well, how many more nickeling and diming mandates are you going to be able to absorb before you basically bust the bank? And remember, $10,299 per person in 2020 or $11,000 today for healthcare costs, insurance plus whatever, direct services you have to pay for. That's going to have a big impact. Now, obviously, if you're younger, it's going to be less. But there's no excuse for this frivolous and unnecessary cost increase when the market should be setting labor rates. I've always said, if we need to increase salaries, recruitment and retention will tell us when and how and where to increase salaries. But $250 per person equates to $500 a couple. It equates to $1,000 for a family of 4 per year. That's what one single bill has now created, a cost ripple, SB 525. And look at the LA Times. Even they have to state the following. SB 525 is one of the most expensive laws California has seen in years and comes as the state faces a $14 billion deficit that could grow larger if revenue projections continue to fall short. Oh, I guarantee you that when the state faces a budget deficit, what are they going to do? They're going to raise your taxes. Again, Newsom and the liberal majority in Sacramento, they're liars, cheats, and thieves. Oh, and don't be surprised when Newsom will put out a tweet like this one. He put out a tweet because, oil prices are up, gas prices are up. Puts out a tweet yesterday, big oil is fleecing Californians. It's just not right. Instead of passing down savings to consumers, big oil companies like Shell used massive profits on share buybacks that benefit Wall Street. This guy is a gaslighter. Gas companies have been pumping up prices, leaving Californians feeling the pinch. No, the politicians have. This guy is a liar. He is a cheat. He has increased the gas tax to the highest rate of any state in the country. He's added a cap and trade tax on top of it. He's choked off the supply of oil production, and then he's made oil refining in the state of California so cost prohibitive. He is the reason for your fiscal pain and suffering. And so on oil, he does the grandstanding and the media gives him a pass. He'll then come out and say that big healthcare companies, hospitals, and doctors are scamming and they're shaking down and they're predatory in their pricing. I hope all of you remember this. SB 525 is the most expensive law California has seen in years. This guy's a con artist, and I'm talking about Gavin Newsom. He signed this into effect. He knew it would be billions of dollars to the state budget alone and billions more to you, the average consumer, but he doesn't give a rip. He cares only about pleasing his master. The union boss, the SEIU union boss, demanded that this bill be signed and imposed on Californians, causing a cost spike that none of us are going to be able to absorb without a lot of pain. Yep, making healthcare less affordable. From the party, the liberal party that says that they're the ones out there trying to make healthcare universal and affordable for all. Nope, we have found the culprit for the cost spikes. The party in power. At Reform California, we're trying to educate the public as to what's actually happening and why they're having cost spikes in their basic day-to-day living expenses. Help us do that by going to the website reformcalifornia.org. Reformcalifornia.org. Sign up as a contributor. Chip in whatever you can. The average contributor does $5 a month. That gives us the ability to fight these fights, educate the public, as well as back candidates for office in the election, so that we can make sure we can change the dynamics of these decisions in Sacramento and at your local city hall. Also, help us break through the liberal media's censorship. Like this video, comment below because it helps with the algorithm. Subscribe to this channel and hit that notification button so that we can give you our daily updates on California news and politics. Until next time, Carl DeMaio, Chairman of Reform California. Thanks for watching. Help us break through the censorship of the liberal media by liking this video, sharing it with your friends, and subscribe to my YouTube channel.